The way in which we plan and provide healthcare in Australia is changing. The national health reforms have highlighted the need to change the way care is provided for patients, including preventing illness and promoting better health at the community level. This is called primary healthcare. An important aspect of the health reforms is the establishment of Medicare Locals. Medicare Locals will help plan and deliver better primary healthcare services. Southeastern Sydney Local Health District is working with the 2 new Medicare Locals in Southeastern Sydney to ensure these changes lead to improved services for everyone and a more coordinated experience of care from GPs through to hospitals and other health services.
Hello, I'm Dr. Greg Stewart, Director of Operations, Ambulatory and Primary Healthcare, Southeastern Sydney Local Health District. Southeastern Sydney Local Health District currently provides a range of health services, including your local public hospitals at St George, Sutherland, Prince of Wales and Sydney. However, we don't just run hospitals. Health services like drug and alcohol, oral health, diabetes education, aged care, health promotion, multicultural health and child and family services are also planned and provided by us. A lot of these services are provided in the community. It's important we continue to improve these services as your needs and the community's needs change over time. Up to now, there's been a lack of full coordination between Southeastern Sydney Local Health District's community services and the services provided by GPs and private allied health professionals, such as physiotherapists. What's exciting about the National Health Reform and the creation of the Southeastern Sydney and Eastern Sydney Medicare Locals is that it enables new ways of planning, providing and ultimately improving primary healthcare services.
What do Medicare Locals do?
Hi, I'm Darryl Williams, CEO of the Eastern Sydney Medicare Local. Medicare Locals are primary healthcare organisations which have as one of their priorities improving your health and the health of your community. How do we do this? Well, firstly and foremost by making local healthcare easier to access. For example, through improving your access to out-of-hours GP care and improving the signposting of primary care services available locally. Secondly, we are actively identifying where you and your community may be missing out on the services that you need, and then taking action through better planning and coordination to address these gaps. And finally, we're seeking to develop strong local partnerships for the improvement of your health. In our patch, partners include the South Eastern Sydney Local Health District, St Vincent's Health Network and the Sydney Children's Hospital Network, just to name a few. But of course, the most important partner is you, and we've been working hard locally to ensure that your voice is heard and that your needs are considered in everything that we do.
How have Medicare Locals identified priority health needs?
Hi, I'm Lynelle Hale, CEO of South Eastern Sydney Medicare Local. Here in South Eastern Sydney, we've been able to establish with the local health district new ways to identify and analyse data about health needs. For example, diabetes rates can be mapped by a postcode district, and this information can be combined with hospital admission data to help us identify where services are needed most in the community, where we can strengthen primary care and where services can be provided closer to home. More importantly, your perspective helps us to identify the health needs in the community. Again, for diabetes, we've partnered with the local health district and the Australian Diabetes Council to conduct the first ever district-wide patient survey, which will be distributed to up to 30,000 patients locally. Furthermore, our recent community consultation process helped us to identify chronic diseases like diabetes, access to mental health services and aged care services as the most pressing joint local health needs. We are already acting on this information. For example, we are working collaboratively with the local health district to establish 2 local headspace sites for improving access to services for young people. This is all important work. However, identifying and acting upon health needs is an ongoing process. We're looking forwards to continuing to hear your perspectives on local health needs and working with you to address them.
New organisations, new relationships, new and improved health needs data? What about the new and improved services for you?
Hi, I'm Tish Bruce, Deputy Director of Ambulatory and Primary Healthcare in South East Sydney Local Health District. A number of programs have been jointly developed across these health needs, and these include Headspace to support general health, support and counselling to young people in our district who may be going through a tough time. Bulbawell, or Healthy Living, which is being developed to improve chronic disease management for Aboriginal people in primary care settings. And Connecting Care, which also targets chronic disease by providing care coordination and coaching. This has been effective for several years and is one of the most successful joint programs developed to date. Through our partnership with Medicare Local and local GPs, we've been able to develop joint care coordinator positions in the primary care sector to better support patients with the management of their chronic disease. We've developed shared information systems which enable much quicker data transfer and sharing between partners than ever before. And we've established dedicated programs on health coaching, which helps to support patients in the day-to-day management of their condition. And it also supports them to make healthier lifestyle choices more easily. To date, over 3,000 patients across South East Sydney District have been enrolled in and benefited from the program, a number which we could not have achieved without the support and strong partnerships developed with the Medicare Locals and the primary care sector.
The way health services are planned and provided is changing. In southeastern Sydney, strong partnerships are developing to help improve the health of our community.